Good evening, everyone. I am Dr. Lewis with Spinal Health and Nutrition. Today, we're going to be talking about a simple topic called headaches. Okay. There are 5 different types of headaches that we're going to go through. You have migraine headaches, tension headaches, sinus headaches, cluster headaches, and cervicogenic headaches. Sinus headache. All right. Oftentimes, people get this confused with the migraine headache because both migraine headache, sinus headaches are very intense, okay, to the point that you want to go into a dark room, turn the lights off, turn down the music, shut off all the noise, okay? But this type of headache, of course, involves the sinuses, okay? So with a sinus headache, someone may feel a significant amount of pressure around the sinus area. Usually occurs around the forehead, the cheeks, the nasal area, okay? Sometimes around the upper portion of the mouth area, all right? Basically, that will occur from any type of virus that will leave mucus behind or a bad cold. But here's the trick. Sometimes if someone is overcoming a migraine headache, that will lead to a sinus headache. Because when someone is overcoming a migraine headache, what will be left behind is the fluid from the brain. Those fluids have a tendency to get trapped in the sinuses, causing more pressure to build up around the facial area. All right. So these are the symptoms. I already mentioned a few. Intense pain, especially if we bend the head forward. When we bend the head forward, that will cause more drainage to get trapped into those sinuses, leading to some severe pain around this area. Okay. Stuffy nose. Okay. Tired and fatigued. Achy feeling, especially around the upper teeth area. All right. So the treatments for this are a little different than the other ones. Of course, I'm always mentioning chiropractic. All right. But these are the causes before I get to the treatments. Allergies can do it. Nasal polyps can do it. Now, what causes nasal polyps are when there's a high amount of white blood cells in our blood. That can cause those nasal polyps to actually clog up the sinuses, leading to an increased amount of pressure. A deviated nasal septum, all right? If someone has a deviated nasal septum, you have to go to your primary care doctor and get that checked out, get that fixed, okay? Yes, some of these treatments may require going to a primary care doctor to get that taken care of, okay? A lot of the treatments that I'm mentioning here are simple things that we can do at home, okay? These are the treatments for sinus headaches. We must apply a warm compress on the facial area. Anything that's warm will definitely help open up the sinuses and cause those sinuses to drain out anything that's clogged in there, especially the mucus or any fluid that's in there. We have to use a saline nasal spray or a saline nasal solution to put in this device called a neti pot. A neti pot, what that is, a pot where you can put warm water in, mix it with a saline solution. It usually comes with a saline solution. And then you're going to take that neti pot and pour the solution up your nose. When you do that, it's going to drain out the mucus, drain out anything that's being trapped in there. And of course, once again, the chiropractic adjustments. I'm so amazed at what I do in my profession as a chiropractor because it works for the majority of these headaches. It will drain out the adjustment. Somehow the adjustments just drain out those sinuses. Dr. Lewis, please subscribe and share this video. And remember, your health is a good investment.